Hi, I'm Dr. Neil Beck. I was a doctor in Perth, Western Australia for 53 years, and I saw a lot of suffering, People with all sorts of problems, all sorts of people, different ages, different socioeconomic backgrounds, different places of birth. And what I was interested in what gave people a good life and what were the things that most gave them a terrible life. And the things that most gave them a terrible life were addictions, worse than cancer, addictions. And I wanted to know what caused addictions, because in health you need to know causes. If you know causes, you can help people to get better much quicker, and they're much less likely to relapse. If you don't find the cause, it's much harder to help them, and even if you help them get better, they're much more likely to relapse if the cause is still there. And what I found was that addiction was really stage 4 mental health. 19 out of 20 addicts had been suffering from severe mental health distress and not been able to get proper diagnosis and treatment. So in the end, they got street treatment, and street treatment was always addictive. The people selling stuff on the streets just want you to be an addict so they can get all your money, and they don't care what happens to you. They might appear to care at first and say, oh, this will help you, but their addictive stuff is going to be a disaster. So the real problem was that people were not getting the mental health care they needed, and so they ended up getting street care, which was addiction. So what were the things that most helped people to have a good life and to avoid addiction? The first thing was mental health, mostly having good feelings, mostly having sound, wise thinking, having good habits and not having bad habits, good mental health. The second thing was good relationships, enough good relationships. People need people. Humans for hundreds of thousands of years have been very close to one another, and people need people. Thirdly, they needed to have high, happy chemistry. Yes, we have about 25 different happy chemicals in us. There are over 20 endorphins. Endorphins are endogenous morphines. Yes, we produce in our brain and our glands morphine type chemicals that make us that relieve pain and distress and help us to feel good. And then there's also dopamine, serotonin, oxytocin and noradrenaline. So high happy chemistry is important. And a strong immune system is important. Our immune system is white cells and antibodies and chemicals in every part of our body that fight infection, allergies, inflammation, autoimmune diseases and cancers. If our immune system is strong, we're going to be healthy. If our immune system is weak, we're going to get diseases. My family was terribly affected by a great-grandmother who died of cancer when she was 42. She'd had 9 children by 3 different husbands and must have had terrible sleep deprivation and overworking and distress, which is what weakens your immune system. And with a weakened immune system, she got cancer and died when she was 45. So happy chemistry and immune system, which work together, are very important. The 5th thing is the habit of smiling often. And why is that? It's because when our happy chemistry is normal or high, we smile and laugh often, and whenever we smile or laugh, our brain and glands produce even more happy chemistry, which makes us even more healthier, strengthens our immune system. And what was the 6th thing? The 6th thing was to know about any major disasters that happened to our mother or father, or their mothers or fathers, or their mothers or fathers' mothers and fathers, our great-grandparents, because their disasters can affect the next 3 generations. And what you think is a major current problem could possibly be due to a disaster in one of the 3 previous generations. And of course, the final great thing to have a good life is to have no addictions. The problem was that there were just not enough mental health care workers to help all the people who needed mental health care. So people were suffering and eventually turning to street treatments because they couldn't get good mental health care and treatment. So how are we going to fix that? Over 27 years, I developed a package of 7 tools, 7 effective tools that help to make mental health care more efficient, so the limited number of workers get more done, much more done. So we needed better tools, and people with mental health problems had to be taught how to use these tools, which had to be simple enough and easy enough for them to learn to do self-help, because if you can't get enough help, you have to do self-help. And if through efficient tools and self-help we could get people could do half the work that they needed, then there'd be enough mental health workers to do the rest of the work. Some people could do 3/4 of what they needed through self-help with good tools. Some people could do half what they needed through self-help with good tools. Some people could only do 1/4, and some people were not capable of doing any self-help, but they would get the self-help, they would get the mental health help they needed if other people were doing self-help, which reduced the workload for the mental health workers by half. And so a complete package of tools, self-help, and the 3rd thing was to fix problems, mental health problems, as soon as they started or as early as possible. What was happening for 2 reasons was that people were not getting mental health help until they were really severely disabled. until many of them had crashed. And the two reasons were, first of all, there was a stigma about mental health. People didn't like to ask for help because they were embarrassed. They didn't like to admit that they had mental health problems. And I'm happy to say that the stigma of mental health is going, and people are much more willing now to admit to having mental health problems and to seeking help early. And the second cause of delay in people getting mental health until they were very severely damaged was waiting lists. There were waiting lists everywhere. So what were the weaknesses in the tools for mental health and addiction? Well, there were only two main tools, and they both had major weaknesses. The first tool was medicines, and medicines had two weaknesses. The first weakness was that so many medicines were addictive. People who could benefit from mental health medicines wanted medicines that were not addictive and that worked quickly, that got them better, then they could stop taking the medicines. But the pharmaceutical industry that makes medicines wanted people to take as many medicines as possible for as long as possible. So they made many medicines addictive. The commonest mental health problems is worry, anxiety problems, and all the mental health, all the medicines for worry, anxiety were addictive. Originally it was barbiturates, and there were many different barbiturates, and they were all addictive. And then it became benzodiazepines, and there were many benzodiazepines, Valium, Seropax, Mogadon, Xanax, all addictive. And I saw many people taking 20, 30, 40 Valium tablets a day, and I had 10 or 11 patients over the years who were taking 100 Valium a day. They just went from doctor to doctor telling lies and getting prescriptions for 50 Valium tablets at a time and taking them all in one day. And why is that? It's because addictive medicines do certain things and don't do other things. Firstly, a small amount of an addictive medicine gives people a lot of relief at first. A lot of relief at first. But addictive medicines never cure anything. They never cure anything. And secondly, addictive medicines cause a person's chemistry to develop a tolerance or a resistance. So then they need more medicine to get more addictive substance to get relief, because the addictive substance has to overcome a developing tolerance or resistance as well as to give the relief. So they need to take a higher dose. And when they take it a higher dose, they get more tolerance or resistance to the addictive substance. So then to get relief, they have to take even more addictive substance, because they have to overcome a greater tolerance or resistance as well as give the relief. So they have to keep taking more and more and more until they're taking a lot. And when they're taking a lot of an addictive substance, it twists their natural chemistry. Their natural chemistry gets very distorted. And once their natural chemistry is very distorted or twisted, if they don't get the addictive substance, they have terrible withdrawal feelings. So they have to keep taking the addictive substance, even though because of high resistance or tolerance, it's not doing very much for them. And that's the disaster. And the street dealers are very happy because people are giving them their money to get big amounts of the addictive substance, even if they have to go without food, even if they can't pay the rent and they're homeless, even if they can't afford any medical health care, because all their money is going to the drug pushers, the addictive drug pushers. Bad situation. And the second weakness of medicines is they're slow. When you swallow a tablet or a capsule, it takes half an hour to an hour to go right down your gut and start to get absorbed into your bloodstream and start to get to your brain or whether it's needed. And it takes 1 to 2 hours to be well absorbed and to work strongly, and that's just too slow. When you are suffering from mental distress, worry, anxiety, sleep disorders, post-traumatic stress disorder, whatever, you want the medicine to work quickly, but tablets and capsules work slowly. And also it's very hard for you to know and to get what your best dose is. Each person requires just exactly the right best dose for them, which depends very much on how much they weigh. If you're 50 kilos, you need a completely different dose to what you need if you're 120 kilos. And with tablets and capsules, they might make 2 or even 3 different strengths, and you might be able to break the tablets in halves or quarters, but it's still hard to find what the best dose for you is. The best dose for you gives you the best result with the least side effects. But because everything comes as tablets or capsules, we tend to think, oh yeah, and unfortunately a lot of doctors think, oh yeah, they need 1 tablet or they need 2 tablets, or maybe they need 1.5 tablets or half a tablet. But it's hard to get exactly the best dose for you, and if you don't get enough, it doesn't work very well, and if you get too much, you get side effects. And what's right for you not only depends on your weight, it depends on how well your gut absorbs medicines, and it depends on how fast your metabolism is. Some people burn medicines faster than other people burn medicines because you use medicines up. And your body excretes medicines. Once the medicine gets into your bloodstream, it's flowing through your kidneys and it's flowing through your liver. And because it's not a natural chemical, your kidneys start to excrete it, and your liver starts to break it down and excrete it through the gallbladder. And if your liver is damaged because what you're addicted to is alcohol or something that damages your liver, then you need much less than if your liver is healthy. And a much lower dose may give you side effects because it accumulates, because your liver is not dealing with it normally. So medicines, so many addictive and slow because they come as tablets or capsules. And the other main treatment, the other main tool for mental health and addiction disorders is talk therapy, counseling, discussion, psychotherapy, group therapy, talk therapy. And talk therapy has 2 big weaknesses. First of all, it's very slow. When a doctor first sees a patient who's got multiple mental health disorders, because if you've got one health mental health disorders, you've always got other health disorders. With physical things, we often only have one at a time. Our body is big, and if there's something wrong with our foot, there's probably nothing wrong with our shoulder or our head. But with mental health things, they're in your brain, and this part of your brain is close to that part of your brain, which is close to that part of your brain. And if one part of your brain is not working properly, the other parts are usually affected. So you don't just have one mental health problem, you usually have 2 or 3 or even more mental health problems at once. Most of the people with addictions I saw had 2 or 3 mental health problems, and I still remember one woman I saw who had 5 serious mental health problems. So talk therapy is too slow. With a new patient, you need an hour to go through all their mental health problems, what probably caused them, what's making them worse, what their family is like, what their home is like, their community is like, their work is like, and what their addiction is about. An hour. And then you need to see them every week for half an hour or 3/4 of an hour. Just too slow. Just too slow. And talk therapy has another big problem. It's too expensive. It costs too much. To be a therapist, you have to be a highly trained healthcare professional. You have to have at least a 4-year psychology degree from a university. And many psychologists have a 6 or 7-year PhD degree. And to be a psychiatrist, you have to have a 6-year general medical training and degree, and then some general medical practice, and then 3, 4 or 5 years psychiatric training and practice. So these therapists are all very intelligent people who had long training courses during which they didn't earn much money or no money, and they need to be paid well. They deserve to be paid well for their skills, their intelligence, and their training. And if we don't pay them well, we'll have even less of them. So, only 2 tools for mental health and addiction. Medicines, so many of which are addictive and which are too slow, and talk therapy, which is very slow and too costly. Not even the government can afford to pay for all the mental health care that's needed. Well, I don't know if they can afford to do it more than they can afford not to do it, because when they don't do it, they have so many other costs. All that policing, all that physical health care that's needed because it's caused by mental health care, because people are stressed and their immune system is low. The court systems, the police systems, the prison systems, the rehabilitation systems, all so costly. I don't know which is more costly, trying to treat all the mental health illnesses before they become addictions, or managing the people after they've had their mental health problems and become addicts and committed crime and become sick. So what was my solution? Over the years, I developed a complete pack of 7 tools for mental health and addiction people. For 5 years I had my own addiction clinic. I started off working in hospitals, as all doctors have to do, and then for many years I was a family doctor in the suburbs doing all the things that family doctors do, except that in the early days we did a lot of things that people and that family doctors don't do today. I helped to bring 800 babies into the world. I did a lot of tonsillectomies, appendicectomies, vasectomies, broken bones and so on, which are now managed by specialists. And I had 500,000 home visits, hospital visits and consultations with people with all sorts of things. And then in the late 1990s, when we had a terrible epidemic of heroin addiction in Perth, I started to work 10 hours a week in an addiction clinic. And I wanted to know what caused addiction. And they didn't know what caused addiction and didn't care and thought that was just treatment. But I wanted to know what caused addiction, so I went to every addiction clinic in Perth and every addiction clinic in Sydney and couldn't find anyone who could tell me what caused addiction or who thought that they needed to know what caused addiction. And then one day in the clinic where I was working 10 hours a week, I saw 15 heroin addicts and realised 5 of them had ADD, ADHD. 1/3 of them had ADD, ADHD. And then when I went very carefully into the early history of all the people who had addictions, I found that 19 out of 20 of them had mental health, serious mental health problems for which they hadn't got correct treatment, so they ended up with street treatment, which was addictive and became addicts. So what were the mental health disorders? The commonest was worry, anxiety disorders, general worry, anxiety, social anxiety, panic attacks, obsessive compulsive disorder, and all sorts of phobias, fear of heights, fear of animals, fear of this and that. And then there were a lot of people with sleep disorders. Sleep disorders were a common mental health disorders. Sadly, one patient I had who said he only slept for 6 hours a week, I don't think he knew, and I didn't know how many hours he really slept, but he certainly had a great sleep deficit that made him so confused and weakened that in the end he hung himself. And that was in the early days when I really didn't know how to help him. So, worry, anxiety disorders, sleep disorders, major depression, so many people with major depression, and then bipolar disorder, a lot of people who are sometimes very high and fast and sometimes very low and slow, and then ADD, ADHD, and then post-traumatic stress disorder, people who'd had terrible things, usually life-threatening things happen to them or to people they were very close to, who kept on re-experiencing the terrible feelings they had in those life-threatening situations. And then very low self-esteem, people who were born in very poor or difficult circumstances with weird or troubled parents, which caused them to have to perform very poorly and have very low self-esteem. And then people who had what I called IAD, irritability anger disorder, lots of people who got irritable and angry, and some who were violent. there was a lot of domestic violence. And I even had one patient who had her head cut off and was buried in a backyard by someone with severe irritability, anger, violence disorder, because murder is the end result often of IAD. A very important disorder, a mental health problem which didn't seem to have a name and didn't seem to have an effective treatment. The treatment for IAD was often alcohol or Valium or Seropax or Mogadon or Xanax, but they soon developed tolerance to those things, so they took more and more and more and became addicts and still had their IAD. And I found in the end that what helped a lot of them most was epilepsy medicine. Some IAD was just bullying, because people found that when they got angry and shouted and threw things, people did what they wanted. So whenever they wanted people to do something for them, if they wouldn't do it, they'd get angry, and then they'd get what they wanted. But a lot of people who got irritable, angry, or violent did not want to be like that, did not want to be like that, did not want to frighten or damage their marriage, did not want to frighten and damage their children, did not want to risk divorce, homelessness, being in prison or living on the streets. But there didn't seem to be a very effective treatment, and I found in the end that because everything they were being given was addictive, or they were taking, like alcohol or marijuana was addictive, that there was a medicine that was only slightly addictive, and it was 100 years old. It was baclofen, a 1920s epilepsy medicine, which was superseded by better epilepsy medicines, but it was still the best medicine for muscle relaxation in people with paraplegia and quadriplegia who get terrible muscle spasms. So how did I discover baclofen? Well, 30 years ago I was managing the Quadriplegic Centre in Perth, which had 100 paraplegics or quadriplegics in it, and a lot of them had muscle spasms, and baclofen was the best muscle relaxant, so I knew about baclofen. But then in New York, a woman doctor with a paraplegic patient who was a cocaine addict who couldn't stop cocaine, when she gave him baclofen for his muscle spasms, he was able to stop the cocaine addiction. And that got written up in the New York newspapers. And then Professor Olivier Amerson, who was a professor of cardiology in New York, who had a terrible anxiety problem and then became a severe alcoholic, read about this in the New York newspapers, and he'd had to stop practicing as a doctor because he had blackouts and because his alcoholism made him so unreliable. And when he read about baclofen fixing this paraplegic's cocaine addiction, he thought he had to try baclofen. He'd been to the 3 best rehabs, and he had all the medicines and all the treatments and therapy for alcoholism, and always relapsed within a day or two. So he thought he had to try baclofen. And when he tried baclofen, it had wonderful relief for both his anxiety and his alcoholism. And he was able to completely quit alcohol. And what was even more wonderful is that he could have one drink in a social situation and then stop again, whereas alcoholics normally only have to have one drink and they're gone again. If they manage to quit alcohol, they have to avoid having even one drink. But baclofen helped Professor Oliver Amerson to be able to have just one drink and then stop again. He tried to avoid it, but there were social situations where having at least one drink was better. So he wrote a book, The End of My Addiction. The End of My Addiction by Dr. Oliver Amerson. And I somehow got that book. I've forgotten how many years ago. And then I discovered baclofen, and then baclofen was far better for all those very anxious heroin addicts than benzodiazepines or barbiturates. But two of my heroin patients got up to 9 baclofen tablets a day because it is slightly addictive. I can't remember one of them, but I remember one of them very well. I can picture her. She was an Asian lady who was a heroin addict who had 2 children that she had to care for, and her husband had just died from a heroin overdose. And baclofen was wonderful for her, but she had to take more and more and more. And then I found that if I mixed baclofen as powder, 3 milligrams of baclofen to 2 milligrams of mirtazapine, which is an antidepressant which has very strong calming effects, and a 3/4 milligram microdose of naltrexone, which boosts your endorphins, which help you to feel better. That combination of powder, 3 milligrams baclofen, 2 milligrams mirtazapine, 3/4 milligram microdose of naltrexone was the best calming medicine for many conditions, including IAD. So, where are we up to? Yeah, so never going to be enough mental health care workers to do all the mental health care work needed. So as a result of that, lots of people not getting mental health care, many of them getting street relief, which was all addictive, and ending up with physical illnesses in hospitals, and addictions, then crime, then prison or a cemetery. Big problem. So I developed 7 tools. The 7 tools were, firstly, a checklist. Because of the slowness of talk therapy, a 20-question checklist which an assistant could do with a new patient enabled me to deal with new patients in 10 or 15 minutes instead of 30 or 40 minutes, because I was swamped. addiction patients all needed dual diagnosis. That is, they needed to have their mental health disorders diagnosed and treated at the same time as their addiction treatment, as their addictions were treated, and they couldn't get it anywhere else. The mental health clinics refused to see addicts, so if a person with a mental health disorder became an addict, they couldn't get an appointment at a mental health clinic. And the addiction clinics did nothing about mental health. I had to sit in at a big government mental health clinic, big government addiction clinic, the big addiction clinic, where I was taught to treat addiction, but really what I was taught was how not to treat addiction. It was there that I realized that what was needed was dual diagnosis, and nobody was getting dual diagnosis. I'm very happy to say now that you can go online and find lots of places where they do dual diagnosis, because that's the only thing that works for addicts, is treating their mental health disorders properly and effectively at the same time as treating their addictions. And because that was so slow, a 20-question checklist, which my assistant could do, helped me to see more people when I was getting swamped with all these people wanting dual diagnosis. And then videos helped. Instead of having to people need to understand their mental health disorders. They need to understand what they are, what caused them, what makes them worse, how to make them better. And that took so much time, over and over and over, every day, explaining to everyone their mental health is. And the right videos could do that much quicker. So about 14 years ago, I think it was, I made my first video on mental health and addiction, which got 10,000 viewings in 9 months, which was so good that I made another 8. And they were helpful at first, but gradually people stopped watching long videos. So I thought, I've got to make them better. And I spent a lot of time making 31 7 to 12 minute videos that covered everything, and they didn't get watched. And then I discovered that people were only watching, or most people were only watching 1 minute videos, TikTok videos. And then I made nearly 100 under a minute TikTok type videos on mental health and addiction, which you can find on the various platforms. So, and then of course we had to have websites, and my first website was mentalhealthvideos.a2z.com, mentalhealthvideos.a2z.com, which was long and detailed and had everything. And then I found most people wanted a very short website, so I eventually made the website smilefixit.com, the website smilefixit.com, which has got everything on one page, and you can tap the link to get more detail about whatever you need detail about. So then we realized that checklists were too slow, and people had to come to the clinic to do them, and it needed a second person, and that apps would be much better. What people needed was a phone app about mental health and addiction that they could do at home anytime, anywhere that suited them, and as often as necessary for them to understand their particular problems, which of course were complicated. If you take 10 years to become a psychiatrist, you don't understand your mental health problem in 10 minutes. So we needed an app. We needed an app that people could download free on their phone and do a check quickly, anytime, anywhere, that would tell them what their problems were and which of our 100 under-a-minute videos to watch to understand that each particular problem. So my first app, starting about 18 months ago, was the Mental Fix-It app, and the Mental Fix-It app had 38 questions that covered everything, and for each question a person had to tap one of three answers, one of the three answers that was nearest right for them, and they could go through the 38 questions, tap, 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 in 10 minutes. But not enough people downloaded that 10-minute Mental Fix-It app, so there were hundreds who downloaded, but we wanted thousands or hundreds of thousands to be able to find and understand their problems through the app. So we reduced it from 38 questions to 19 questions, which they could tap their choice of answers in 5 minutes. But that wasn't fast enough. So now we're working on redoing the Mental Fix-It app so people can do it in 2 minutes. My goal is for a troubled person to be able to whiz out their phone, which they always have in their pocket, and in a few seconds tap the App Store or Google Play button and download the free Mental Fix-It app in seconds, and in 2 minutes tap their choice of scores for each particular problem, and then in seconds read the instant report that comes up as they tap their choice of scores for the last question, and see links to the 6 under-a-minute videos that will most help their highest scoring mental health and addiction problems, and be able to watch those 6 problems and get a very good understanding, or begin to get a very good understanding in 6 minutes. So 10 minutes, seconds to download the app, 2 minutes to do the app, and 6 minutes to watch the 6 most helpful videos that will help their particular worst problems. We're not there yet, but we hope to get there soon. My tech assistant went to the US on the 1st of December and will be back on the 1st of March to do a study course in New York and to see what he could find in other places in the world, and he'll be back on the 1st of March, and then the first thing we'll do is make our 5-minute Mental Fix-It app into a 2-minute Mental Fix-It app, and have a 10-minute powerful help plan for people who are mentally troubled and may also be addiction troubled. And then the next tool, so videos, websites, the mental fix it up. The next one is live streaming, which we're doing now, which so many people find to be a very helpful way, and that's where they go. They go to TikTok and they scroll. What are they doing? I've tried to work that out. And this is what my thinking is. TikTok videos prioritize speed, so brevity over detail. Does that attract scrollers who are just filling in time or avoiding boredom? Or does TikTok brevity attract people who think what they want is rare, so they have to cover a lot of ground to have any hope of finding it, like they're looking for a needle in a haystack? Or do they feel needy but unsure what they need and just hope if they spend enough time looking through enough stuff they might discover something that really helps them? And TikTok brevity helps them to get through a lot of stuff very quickly. So here's my thinking. Let's put all the main things humans need most in brief, undetailed, rapid, under a minute videos they can race through and be sure to see all the important things they could be in need of, with links they can immediately tap to go to a bit more detail to confirm they've struck gold, then more links to get full information when they find things that really start giving them what they most want and need. Every fast page should have a diamond, not a needle, stated briefly, so people can race through it all and be sure to find what they need, then get the full detail and understanding. So what were the other tools? I've mentioned 4, there were 3 others. The 5th tool was powder medicine. Why powder medicine? Powder medicine, non-addictive powder medicine, because it works fast and people can find exactly what they need fast. When you swallow a tablet or capsule and it takes 30 to 60 minutes to start to work and 1 to 2 hours to work well, that's too slow. But if you drop thousands of granules of powder medicine on your tongue and you suck it, don't swallow it, and absorb it through your tongue, it starts to work in 5 minutes. Your tongue is pink or red because the blood vessels are so close to the surface, and the thousands of granules get into those very superficial blood vessels quickly and into your bloodstream and to your brain or wherever they're needed, starting in 5 minutes and strongly in 10 to 15 minutes. And it's even better than that. If the powder tastes very nice, you soon get what's called taste conditioning. Your body connects the very nice taste with starting to get better in 5 minutes. And conditioning was found 100 years ago by Pavlov, a Russian psychologist, with dogs. With dogs and meat. But we can have powder medicine conditioning today, which starts the powder medicine working in seconds. as soon as you taste it, as soon as you drop it on your tongue and it gets to your taste buds and you taste it, it starts to work because of taste conditioning. So your mental health distresses and your addiction cravings can start to be reduced in seconds and can be reduced substantially in 5 to 10 minutes instead of an hour or two. And it's even better than that, because powder helps you to find your personal best dose, and to get that personal best dose far, far better than tablets or capsules, because the first powder we give you is very weak, and you try 1, 2, 3, 4, 5 or 6 doses of that very weak powder medicine, and you find how many doses gives you your best result and gives you your less side effects. That's what you want, the best result and the least side effects. And if you find that 4 doses of weak powder give you your best result and your least side effect, then we can then give you that amount of medicine in 1 dose of powder in a pocket powder medicine dispensers, because powder medicine in bottles with little scoops was clumsy and a bit dangerous. So my 6th tool that I developed was pocket dispensers, which give 1.2 ml dose of powder medicine. You can keep it in your pocket and take it anytime, anywhere, and take your personal best dose, because we've found what your personal best dose is, and start to get better in seconds, and start to get a lot better in 5 to 10 minutes. And powder medicine is even better than that, because you can mix 2, 3 or 4 powder medicines together. Because people who have a serious mental health disorder never only have one mental health disorders. If one part of your brain not working very well, then the parts near it are affected. And so people with a serious mental health disorder always have 2, 3, 4 or 5 mental disorders. Some of them might only be minor, but they're still a problem and part of the problem, and that's what drives them to addictions. So I still remember one man that was middle-aged man that was referred to me by his family doctor because he was taking 17 Stilnox tablets a day. Stilnox tablets are sleeping tablets, which in America are called Ambien. So, and they're very addictive. And this was a mentally disturbed man who used to often threaten his family that he would commit suicide. And to fix his problems, his doctor had given him Stilnox, which was very common, but he'd had to take more and more and more till he's up to 17. And so his doctor sent him to me, and I diagnosed his mental disorders. I can't remember what they were at the moment, but there were several, as they all had. And they required 3 different medicines, and so I gave him prescriptions for 3 different tablets, and they worked very well for him. And for the next 3.5 years, with those 3 different medicine tablets, he was far better than he'd been before, and he was very grateful for that. But then he disappeared. and he was living alone, and his son found him unconscious on his kitchen floor where he'd been for 2 or 3 days because he'd taken an overdose. He'd taken overdoses quite often before, but usually with only one medicine, which wasn't fixing him. But he was then carted off by ambulance to a casualty department where the casualty doctors didn't understand his very complex mental health problems and his need for multiple medicines, so they reported me to the medical board for giving him too much medicine. So then my sixth tool was pocket powder medicine dispensers that only give one dose, small dose at a time, so people can't overdose. If they try to overdose, they have to keep on pushing out one small dose after another, and they usually feel better before they reach the overdose level. And the seventh tool was a heartbeat meditation aid, because meditation is so helpful for people with severe mental health issues. It helps them to feel calm and more relaxed, and to be stronger and to function better. But the people who most need to learn to meditate usually can't learn to meditate, because meditation is focusing on your breathing and stopping focusing on your problems, or focusing on a word and repeating it over and over again, which helps you not to focus on your problems. But people who are very troubled, focusing on their breathing or a word is not attention grabbing enough to allow them to stop thinking about their problems. But I'd been listening to people's hearts with stethoscope for 50 years, and I knew that the heartbeat is strong and loud and interesting and attention grabbing, and so I cut a stethoscope short to allow people to listen to their own heart. That's the listening part. You just put it down behind your clothes over your heart on the upper left side of your chest, and listen to your loud, clear heartbeat, which is very attention grabbing, which helps you much more to stop thinking about your problems. And as you are able to do that, meditation gradually improves your epigenetic functioning of your brain, until you can eventually meditate after a couple of months, focusing on your breathing, which is the best thing to focus on, because steady breathing is very important. Our breathing is very connected to our feelings. When something bad happens, we gasp and hold our breath, and steady breathing is a great help. And steady breathing helps you to meditate. Notice when you are in bed trying to go to sleep that just before you start going to sleep, your breathing gets very steady. So the seventh tool was a heartbeat meditation aid, and we can send you one for $25 plus postage anywhere in the world. And I've got some more tools. This is another one, the 8th one, which we will have available en masse at the end of March or April. This is just a prototype, and this larger pocket dispenser, which you can have with any, give you a 1 ml taste of lovely fruit powder, which is not medicine, not addictive, and our gut and our taste and our functioning is very geared to fruit powder or to fruit. And fruit powder is now becoming more and more popular worldwide for making sweets and desserts and drinks and thick shakes. So it's available and people love it. And if you've got a lovely fruit powder in your pocket, and my favorite is vanilla, you can whiz it out and have a taste anytime, anywhere, and that helps you to stop putting other stuff in your mouth. Stuff that causes diabetes or obesity or blocked arteries because of the fat and sugar in the blood, or addictions. And we've got a couple of other tools coming. Well, I think that's enough for one day. Please send me your comments, your questions, your criticisms through the platform that you usually watch live streaming, or through our email address for that problem. Our email address for that, for sending us comments, questions, and criticisms, is healthestuff@gmail. healthestuff@gmail, spelt as it sounds, or if you can't remember it, go to the simpler, more easily remembered smilefixit.com website, smilefixit.website, and find that email address. And every time I do live streaming afterwards, I go through all the new followers, likes, comments, questions, and respond to as many as I possibly can. I don't have links to everyone, so I can't respond to everyone, but I respond to as many as I can. Yes, so I'll be back again on live stream on Wednesday, Friday and Saturday at 7 p.m. Perth time and 9 a.m. Sunday Perth time, which is 11 p.m. Sydney and Melbourne time, and 7 p.m. is 7 a.m. New York time, 4 a.m. LA time, some ungodly hour in London. So we do the Sunday session at 9 a.m., which is a more user-friendly time in the Northern Hemisphere.